You ever feel like your brain just works differently? Like you can't get organized. Your emotions are all over the place, and no matter how hard you try, life feels harder than it should. You ever get that feeling? If you have ADHD, BPD, or even both, if they both occur together, if they're comorbid, this video is going to help you explain why your symptoms are overlapping and why they amplify each other and what you can do to break the cycle. Because I got to give you those tips. That's important. So let's get into it. And here we go. Why this matters. So ADHD and personality disorders, particularly BPD, they often overlap. And what happens is this exacerbates symptoms. It makes symptoms worse. And untangling which is which can help you understand your triggers and stop attacking yourself and blaming yourself. Now, you're going to learn ADHD traits fuel emotional spirals and how BPD or other personality disorder traits amplify executive dysfunction. And also what you can do about it, because that executive dysfunction gets hard to think, hard to plan, hard to organize your thoughts. And ADHD traits hit harder when BPD and not even the full disorder, or when BPD traits are also on board. I'm going to talk about 10 areas in which ADHD and BPD combine to make your life harder, whether it's parenting, relationships, connecting with others at work, whatever it may be. So let's get into the 10 things. Let's get into it. Now, number one, chronic lateness. Now, ADHD adds something called time blindness. And this can make it really tricky because it's hard to focus on time. It's hard to keep track of that. And it can really complicate task switching issues. And this sequencing ability is going from one task to another. And ADHD pushes you, particularly if it's the hyperactive type, pushes you to try to manage everything all at once. And it's super, super overwhelming. Now, BPD, when you're engaging in this, right, you're trying to keep that your time, you're trying to manage all these things that are going on, but ADHD adds to time blindness. We know that, and task switching issues. So BPD, then that adds another layer of shame, self-hate, and fear of rejection, because a lot of times you don't feel like you're keeping up with things, the things that are going on in your life. So you feel like you're disappointing others, which amplifies that tendency to self-attack, that shame that you feel, and can even add to that feeling of rejection. So because you're not able to keep up, or there's a barrier to managing all these tasks, then you engage in the self-hate, then you get overwhelmed, then you feel like you're disappointing others. And this could be you're running late for work, right? Your drop-off schedule is always late, or you're always off if you're dropping kids off. Or date, like you're spiraling into I'm a failure because you're trying to get to places on time, you're trying to complete tasks, but this chronic lateness gets in the way. Number two, procrastination until panic. You ever have that one? And this could be because the ADHD component is that you need a degree or an amount of adrenaline to activate your focus. And ADHD, sometimes what happens is that you're so distracted and you're trying to manage all of these things and you're not really planning, because sometimes it's impulsive. So you put it off, put it off, put it off, but it's not like you're putting it off to just sit still and hang out. You're dealing with something else, and then you're managing something else, and then you're managing something else. But there tends to be this lack of adrenaline, because the adrenaline can help you really sort of zone in and focus. But with BPD, because you procrastinate, you put it off until the level of panic, that panic activates emotional dysregulation. You start to melt down. You start to attack yourself. You see this occurring in your life. You're ignoring bills or work projects until the very last minute. Then, because you're so overwhelmed, then you get crying episodes, crying spells, all of this emotion. Maybe you act out in anger or frustration, or maybe you're somebody who throws stuff. Please don't throw stuff. But maybe that's what happens. It's this procrastination until panic. And you can see how ADHD and BPD, how they feed each other. Because when they combine, it's harder to focus. It's harder. And that adrenaline, you get amped up, but it tends to be used to attack yourself. And that makes it even more difficult to get a handle on stuff that's going on in your life. Let's talk about number 3. And this is that you need music or noise to start tasks. Now, this is pretty common, but in ADHD, we know that dopamine is a booster and that can kickstart some focus. So you get a little dopamine, you're able to focus a little more, and you're able to really sort of zone in a little bit more. But BPD's on board. So the silence, without that music, it leaves space for self-attack. So you need that constant noise, that constant interference. Otherwise, you attack yourself. You feel a lot of anxiety, and that can open the door to some intrusive memories, thoughts about what's happened in the past, people that have hurt you, can even bring up fear of abandonment issues, rejection sensitivity, and feelings of emptiness. And those are those 3 core content components related to BPD. Now, this manifests in that you can't clean the kitchen, you can't do laundry unless a podcast is playing. You can't focus on anything unless there is an additional distraction. And more of us, this is becoming the norm. And what happens is with ADHD, this is beyond the norm. All of us have all this noise going all the time, right? All of these different distractions. And we're always looking for that dopamine hit. But what happens is that with ADHD and BPD on board, it gets even more convoluted and confusing. Now, I understand the need to have music on or your AirPods in or your headphones on or whatever it may be. And you do get a bit of a dopamine hit. Like, I get that. We're all these just hedonistic dopamine seekers. I mean, I get it, right? We've all been doing that. Thing is, nowadays, because of all the electronics that we use and how our life tends to be set up, we're constantly seeking dopamine hit in a more intensive manner. And when ADHD and BPD is on board, that's when we have that feedback loop and we have that need. But it throws us off because of the disorder component, because you're attacking yourself. You are having more anxiety episodes, panic episodes. You're trying to block out these intrusive memories and thoughts. So it adds this layer of confusion, and that attaches and drives you to feel like you need music and noise to start those tasks. And we're going to talk more about what to do that in just a little bit. The next one is having a constant internal monologue. And ADHD really adds to racing thoughts. It's like having 50 browser tabs open, and you're trying to manage all 50 of those browser tabs. You're trying to get them all right, and you're trying to listen to this, but you're trying to do that, and you're trying to manage all these things. But it's hard to keep it going. And then the BPD component comes in, and often that internal monologue, which is being self-critical because you can't manage all 50 of those tabs together, then you start replaying every perceived mistake, because then you start getting hypercritical, self-critical. Oh, I didn't do this. Oh my God, I made this mistake. And then you might find something in your musing, so to speak, or in your processing, or all those racing thoughts. You hit something, maybe you did make a mistake. But what happens is then BPD grabs hold, and that gets amped up. And the way this manifests, it's obsessing over maybe a work comment or something that a friend says, or you're replaying a partner's tone for hours and hours, and you're playing it over and over and over in your head. And that becomes a form of self-attack. But because of that ADHD, it's harder to cut down those browser tabs, for example, to maybe 2 or 3, because you got all 50. And the expectation is, and this is part of BPD, the expectation is you're going to manage all 50 at once, and you just can't. It's just impossible to do that. Number 5, losing train of thought mid-sentence. And ADHD creates what's called a working memory lapse. And because of inattention, right? So ADHD has 2 components, inattention and hyperactivity impulsivity. And that working memory lapse is that you don't take in the information fully. You take in pieces of it. And when you take in pieces, you're not able to get the full sense of the data, of the information. Maybe it's something a friend told you. Maybe it's something your boss told you. Maybe it's something your therapist told you. Could be. And BPD gets into the game on that. And because you have this memory lapse, right? You lose your train of thought mid-sentence, then shame and fear that others see you as incompetent or stupid. Then that starts the self-attack. And the more there's a self-attack, the worse you feel. And it amplifies your ADHD symptoms, which amplifies your BPD. So you see, we're back to that same feedback loop. And this can happen mid-conversation. You blank out at work, or you're talking to your boss, or maybe you're communicating an idea, or maybe you're giving a seminar, and sometimes you just lose your train of thought. That's happened to me a bunch of times. But I know that happens to everybody a bunch of times all the time. I don't start attacking myself for it. I usually say, wait, I lost my train of thought. And usually there's somebody nice kind of in the audience who help fill you in. We all have those memory lapses. What you don't want to do is then turn it on yourself and attack yourself. You don't want to start thinking, they think I'm an idiot, because that is going to amp up BPD, which is also amping up ADHD. And when both of those are really going full steam, you're just overwhelmed. Your brain is just overwhelmed. It's like you got caught in the middle of a bowl of Jello, right? And you're just kind of stuck in that Jello. Well, what are you going to do, right? Somehow you got to get out of the Jello, and crawling out of Jello, not that I've ever done it, it's probably pretty tough. I'm going to imagine. Can't be easy. Can't be easy. Number 6, sensory overload. Now, your ADHD, your brain can't filter all of the sounds, the light, and the movement that's going on around you because of the hyperactivity, impulsivity, and or the inattention. So what happens is that you're trying to take in everything, but you are getting overloaded, so you don't end up getting all the data, just like I mentioned a moment ago. And because that happens, the overload, that sensory overload, triggers emotional meltdowns, irritability, or a complete emotional shutdown. You ever have that where you get so overloaded with thoughts, feelings, ideas, sensations that you just shut down? And ADHD increases the likelihood that that's going to happen. Now, you can end up with grocery store chaos. And this can make you really frustrated. A lot of us, there's a grocery store effect, right? You go into the grocery store and everything's going on, and boom, you forgot what you're there for. Doesn't mean you have dementia. It means that you're like the rest of us and you got overloaded because you go in there. Maybe it's the produce, and maybe they have stuff on sale, and maybe they got that, and you just get overloaded. And you're like, wait, what? What am I even doing here? And that's why lists are important. But it's part of that sensory overload. And what happens is that if you get frustrated and you start to have a meltdown, or you get irritable, then you attack yourself because it gets attached to shame and guilt and all of those factors. So then you start really admonishing yourself so you feel worse, which amps up the tendency to be overloaded. Number 7, rejection sensitivity dysphoria. Now, I could do a whole video on this if you'd like. So rejection sensitivity dysphoria. For ADHD, what this is extreme pain from rejection, whether it's real or imagined. And folks with ADHD, because of the inattention component or the hyperactivity impulsivity, they feel different. They get that sense, that neurodivergence sense that, well, I'm not like everybody else. I don't think like everybody else. I don't process information like everybody else. So there's something broken in me. And that triggers fear of abandonment. It can even add to identity issues, and it can even drive behaviors that sabotage relationships, work relationships, even relationships with your kids or with your parents or with coworkers, whatever it could be, with your partners, romantic partners. It can absolutely add to and complicate those problems. And what happens is that kicks it up again. Here we are back to that feedback loop where you start thinking they hate me. That rejection, sensitivity, and dysphoria. It's this sense that I'm different than everybody else, and because I'm different, that means I'm broken. If I'm broken, nobody wants me in their life. So if nobody wants me in their life, then they're gonna kick me out of their life, abandon me, or completely reject me and not allow me in. And that amplifies BPD. And that amplifies the probability that you're going to attack yourself. And you see this happen over and over and over again because of your different, even in various relationships, particularly those that are most important to you. Those are the ones that typically individuals are most sensitive to. So when you have problems in those relationships, you really do internalize it. And that increases the likelihood of self-attack for those things. Number 8, out of sight, out of mind. ADHD, if you don't see it, you forget it exists. This could even be people too, because there's so much going on. You're, again, going back to all that sensory information. Remember, these 10 things aren't mutually exclusive. They all operate in varying forms and degrees, but they all can operate at the same time. Now, you may have some that are more particular, more likely for you, and someone else may not. And in this case, being out of sight or out of mind is that, again, you don't see it, so you forget it. And this could be people, this could be tasks, this could be work tasks or things that you promised your kids you would do, your parents or your friends or your partner, stuff like that. So then, again, increases the probability of fear of abandonment, or this can be what's called object consistency issues. And that means for folks with BPD, if they don't see it, or if they don't have it immediately in front of them, and this could sometimes even be like a text response or something like that, texting back, or someone texting back to the person with BPD, that what happens is then they're like, well, I mean, where are they? What are they doing? Maybe they're dead. Maybe they don't exist. Maybe what's going on? And then you just start thinking. And so what happens is then you start thinking, well, they forgot about me. They don't care about me. They've left me. They're cheating on me. And so it all starts from this out of sight, out of mind. We have to remember that other people have stuff that they're doing that doesn't have anything to do with you. Doesn't mean that they don't care about you. But what it means is they have other tasks that they're focusing on. So it's particularly difficult for them to respond right away. But your BPD amplified by your ADHD, now you end up attacking yourself. Because out of sight, out of mind, you made an error, you're writing them, that object constancy, what happens is, well, do they even exist anymore? Are they in my life anymore? Have they kicked me out of their life? So it starts all this panic and all of this anxiety and all this worry and all of this fear. So then you start blowing them up. Why are you mad at me? Why did you do that? And then that increases the likelihood of having a relationship problem. Do we have to try to manage these things, which we're almost there? We're going to talk about in just a second. Number 9. What about interrupting and oversharing? Now, I know this is a big issue for folks with BPD, also a big issue with folks with ADHD. Now, impulsivity, they end up just blurting stuff out, and they're not processing, they're not balancing or reasoning what they want to say or what their goal is in having the conversation. They just impulsively blurt stuff out without thinking of it. And when you overshare for folks with BPD, that kicks off shame and fear, and it tells you your BPD tells you you're too much. You're too much for this person to handle. They don't want to hear all your stuff. Then you get back to that self-attack. In real life, it can be like trauma dumping on a friend when they panic or you're afraid that they've ghosted you and you're not sure what you're going to do. And I told them too much, or I exposed too much, and I'm doing too much. And I'm not sure, what I did or what I said, or told them too much, or maybe I'm trying to get too close. And you're trying to balance their side of the relationship, not just your side. Remember, we can only control our side of the relationship. You can't control theirs. That goes relationships with coworkers, parents, partners, whoever it is. You can only control your side of the relationship. That means your own behavior and the things that you say and think. But BPD and ADHD make it worse. They skew you towards the negative And you got to be on the lookout for that. Number 10, the last one. This is time blindness and task overwhelm. ADHD, you have a poor sense of time, and big tasks feel impossible. This sounds a lot like number 1, and we're going back to pull it back because we got to revisit it a bit. Because what happens is that poor sense of time and big tasks feel impossible. This could even be small tasks then because they've been ignored or because you've put them off for a while, that now they've become big and urgent tasks. And now you're overwhelmed and you feel like you can't engage because it's too much. So then BPD kicks in, then you have a shame spiral. Then you get this sense of an almost like paralysis where you feel like you're so behind, so overwhelmed, so underwater that you're almost frozen, right? Now you're in the freezer, right? And you're in the freezer and you're stuck in an ice cube. You're not in the jello, right? Where you had a chance to crawl yourself out. Now you're frozen in an ice cube, right? You're Han Solo, right? Frozen in the carbonite. And so then you attack yourself. And this could be like you avoid paying your taxes, cleaning, or relationship talks until crisis explosion. So you put stuff off, you forget to talk about, oh, I meant to do this, I meant to do that, and it becomes too much, and you're trying to manage everything all together, but you get overwhelmed, ADHD, BPD kicks in, everything becomes amplified, so you have a sense of being lost. Folks with ADHD struggle with triggers of emotional dysregulation, which is very similar to what we've been talking about with BPD. And BPD has these fears, such as abandonment or rejection, and that gets amplified by ADHD related avoidance, procrastination, and impulsivity. And again, and we talked about this several times, it's this feedback loop. Well, if you're stuck in the feedback loop, what can you do about it? Are you doomed? First of all, hold on a minute. You're not doomed. That is important. First, what I want you to do is I want you to put a name on it. And naming it is so important because if you can isolate it and name it, then you have a better idea as to when it occurs and what it is. When ADHD avoidance triggers shame, then call it out. Call it that. Oh, wait, this is probably more ADHD trigger shame. Whatever you want to call it. And that's going to help you identify it. You got to separate your behavior from your worth. Lateness isn't proof that you're a bad person. It's executive dysfunction. If you have ADHD, you have a higher probability of executive dysfunction, which is why it's harder to manage all of these things that you need to do and creates a higher probability of procrastination. You need some external supports in place. These could be visual reminders. What I like to do is I'll send myself an email, and by the end of the day, I try to go through all of my emails and clear my email box. So I'll send myself a reminder in the email to make sure that I get it done. And I won't clear that email until I get it done. Now, that could be problematic because if it becomes 1, could become 2, could become 3, could become 50. See, we can't do that. We have to try to work it down each day because if it gets up to 50, you could be really overwhelmed. We don't want that. Could also be time blocking. Block your schedule as much as you can with time to get things done. It could be 6 to 6:15. Doing small increments can have great value and payoff as opposed to ignoring it and never doing it. BPD is going to tell you you have to do it all right away, otherwise you're a terrible person and you're a failure. No. Don't fall for that. Don't fall for that. We're not going to do that because even a little bit moves you in the direction of achieving your goal. Don't choke on the entire burger all at once. Just have a bite of the burger. You'll get through the burger in time. Don't shove it all in right away. Don't do that. And then also some sensory regulation tools. This could be actually, and I know there's going to be some dissonance with this one. You're going to be a little uncomfortable with this one, but is maybe not having music on when you're reading or studying. Maybe having some quiet time for yourself. Maybe also going for a walk so you can kind of process some of the things that have happened. Slow down. And you have to process for like 3 hours. Just 3 minutes Just give your brain time to catch up. And I know that that can open the door to perhaps some of those old memories that you're trying to avoid or anxiety. Those are indicators that a mental health provider may need to be helping you through some of this stuff, and that's okay. That's okay. Don't forget. That's what we're there for. Emotional regulation first. Now, you can't time panic attack. So, if you start to feel like you're getting overwhelmed, slow down. If you don't have a heart condition or a medical condition, panic attacks, that's all they are. They're just panic attacks. You're going to be fine. You're going to be fine. If you've had them before, you live through it. And I'm not dismissing it and saying they're not uncomfortable and they're not scary as heck, because I totally understand that. But we can really inadvertently empower the panic attack by being afraid of it, by living our life so we don't have another. And that really gives it a lot of power and control over your life. We don't want to do that. Slow down and manage it as best you can. Breathing is amazing. There's all types of stuff on YouTube or all throughout the internet that can help you slow down and relax. And that can really help you get control of that panic. Sometimes you got to go a little deeper and see what's driving that panic. And again, a mental health provider can help you out. And, therapy can be great, can really help you. DBT can absolutely, that's dialectical behavior therapy, can absolutely help you with emotional regulation and ADHD, coaching for structure, providing a sense of structure for yourself and routine. Human beings thrive on routine. We do. One of the things that I read a while ago and it's really stuck with me, success is achieved through daily routine. Success is not achieved through an instant. It can seem that way in hindsight. Oh, you finally did it. But any overnight success, for example, usually took 10 years to get there. So don't forget that one. And remember, you're not lazy, crazy, or broken, right? You have overlapping conditions that amplify each other, ADHD and BPD. The goal isn't to fix yourself. Okay? It's to understand your brain and emotions so you can work with them, not against them. The harder you push against them, the harder they're going to bounce back and bump you in the nose, right? It's like chucking a racquetball at a wall. If you chuck it really hard, it's going to come back really fast. If you lightly lob it, it's going to come back really slow. And life is a lot like that too. Life is like a racquetball. Leave some comments and thoughts about how your ADHD or your BPD, how they amplify each other in the comment section. Also, how do you deal with it? How do you manage it? And medication can help with the ADHD stuff, and it can only help with the BPD stuff some of the way. So, how do you manage it outside of medication? What else could you do? Because I think people really do benefit from the comments, and I appreciate so many people leave great comments. I try to reply to as many as I can. And thank you all for your time and attention, and I will see you next time.